Today on Windy City Live, a full hour dedicated to your health. A panel of doctors explain what your body is telling you and top warning signs that something may be wrong.
It might sound a little strange, but doctors will tell you there's a strong association between oral health and heart disease. And here to tell us more about it from the Chicago Dental Society is Dr. Boghosian. Hi, doctor.
Hi.
So it seems a little strange, but heart disease, gum disease, there's an association between the two.
There is, and you know, I don't know that it's so strange. Our mouths are connected to the rest of our body. Just like anything else, you see somebody whose skin color isn't quite right. You say there's something a little bit wrong. So then when we as dentists look in somebody's mouth, we can see many things that might send up red flags that alert us to the fact that there might be a systemic condition going on, not just gum or tooth disease.
Right, like what? Like diabetes you're talking? What other kinds of things?
We can see, well, for example, I had one patient, her gums just weren't quite right, but there was nothing more that I could do for her dentally. So I said, when's the last time you visited your physician? She said, it's been a while. Saw her physician. She was diagnosed with liver disease.
Wow.
Now, I couldn't diagnose her liver disease, but she was put on the proper medication. When I saw her again, her tissues looked normal. So it's very important to pick up on these little things, and most people do see their dentists a little more often than they do their physicians. So it's something that we can help save somebody's life potentially.
Right, and everybody loves going to the dentist, so it makes sense. But let's talk about gum disease first, because that's another thing that can lead to, you know, more things bad for your health. So let's take a look at a picture here. We have a picture of gum disease.
Sure.
And what other things can come from this?
Well, the picture that you see on the left side is a picture of teeth that have not been cleaned very often, and that's a layer of what we call calculus. The average person calls it tartar. On the other side is when that tartar has been removed, but you can still see the redness on the tissues. Those teeth are still, the gums are still not healthy. Along with that, the tooth is held in the jawbone, and sometimes the bone can also disappear and teeth can loosen up. That's when we lose our teeth as a result of gum disease.
Now, can gum disease be passed through kissing?
Gum disease, in order to avoid gum disease, you need to brush your teeth properly, floss your teeth, visit your dentist regularly. There are bacteria associated with it, but I'm not so sure I would connect those dots very closely.
Yeah.
More importantly, brush your teeth twice a day, floss daily, visit your dentist regularly, and you should be in good shape.
All right. What about oral cancer? We have a picture here. Tell us how often or how common is this, and what other things come from this?
Well, every time you visit your dentist, he or she should be doing an oral cancer screening. That consists of, we use our hands, we use our eyes, we move the tongue around the mouth, we feel for lumps, we look for areas that look a little bit suspicious. There are also another aid on top of that can be a light that we shine in somebody's mouth to pick up on what's going on below that tissue. The benchmark, however, is your eyes and your hands. But there are all kinds of instruments out there that can help us detect oral cancer. And you know, oral cancer is on the rise. We're seeing cases where patients don't fit the risk factors of being a smoker or using alcohol heavily. They do not have those risk factors. They are still getting oral cancer, and it is related to the human papillomavirus. So again, very important you catch that early in terms of seeing your dentist. You get better help. You get a better chance of getting yourself on the right path.
All right, Dr. Boghosian, thank you so much for all the great information. And remember, this is not a diagnosis. If you have any of these symptoms that we talked about, please see a healthcare professional to be evaluated.